There's something most men over 60 are doing in private that's slowly causing damage. And the worst part? They have no idea. They think everything's fine. They think because they've been doing it the same way for decades, nothing could possibly go wrong. But that's exactly where the problem starts. Because your body at 62 or 67 is not the same body you had at 30, not even close. And the habits you carry from those younger years, the ones that felt completely harmless, some of those habits are now quietly setting the stage for real issues. Issues most guys won't connect to the actual cause until it's too late. I'm Dr. Natalia Parker, and today I'm going to walk you through exactly what's going wrong and how to fix it before the damage gets worse. We're talking about masturbation after 60. And before you click away, hear me out. This is not some awkward lecture. This is about protecting something that directly affects your prostate comfort, your circulation, your nerve health, and honestly, your quality of life for the next 20 years. Because here's what I see in clinical practice all the time. Men come in with symptoms they can't explain, soreness that won't go away, a strange curve that wasn't there before, reduced sensation that keeps getting worse year after year. And when we trace it back, in many cases, the root cause is shockingly simple. It's how they're doing something they've done their whole life without ever adjusting for what age has changed in their body. Now, I'm going to break down the 3 most dangerous mistakes I see men make, but I want you to pay close attention to the third one, because that's the one almost nobody talks about, and it's the one that can trigger a chain reaction of complications that are completely preventable. We'll get there, but first, let's start with the mistake that's so common it's almost universal. Most men over 60 are skipping one critical step, and it's the step that protects your tissue from mechanical damage every single time. I'm talking about lubrication. Now, you might be thinking, I don't need that, I've never used it before. And that's exactly the mindset that gets men into trouble. Because here's what changes after 60 that most guys don't realize. Your skin, especially the skin in that area, loses elasticity. It gets thinner, drier, more fragile. The natural moisture your body used to produce, it decreases significantly. So when you apply friction to tissue that no longer has the same protection it once did, you're not just creating discomfort in the moment. You're creating micro tears, tiny, invisible injuries that your body has to repair over and over again. And here's where it gets serious. Repeated microtrauma to penile tissue has been associated with a condition called Peyronie's disease. That's when scar tissue builds up internally and causes a painful, abnormal curvature. And once that scar tissue forms, it doesn't just go away on its own. It can become a permanent problem. A problem that affects everything from comfort to confidence to your ability to be intimate with a partner. All because of friction that could have been avoided with one simple habit. So, what's the fix? It's straightforward. Use a quality lubricant every single time. Not sometimes. Every time. Water-based options are the easiest to clean up and they're safe with any material. Silicone-based lubricants last longer, which is a better choice if your skin tends to be drier or if you prefer a longer session. One thing to keep in mind though, silicone lubricants don't mix well with silicone accessories, so if you use any, check compatibility first. And oil-based products should never be paired with latex because they break down the material. The key here is to apply generously, don't be conservative, and reapply whenever things start to feel like there's resistance. Think of it like this: you wouldn't run an engine without oil. Your body works the same way. Friction without lubrication causes wear, and after 60, that wear happens faster and heals slower than it used to. Now, that first mistake is dangerous enough on its own, but when you combine it with the second mistake, that's when I start seeing men walk into my office with problems that could take months to resolve. And this second one might surprise you because it's a habit most men have carried since they were teenagers. It's about force, pressure, intensity. When you were younger, gripping harder and moving faster might have worked. Your tissues were resilient, your blood vessels were elastic, your nerves could handle it. But after 60, that same approach is like putting high-performance stress on a system that now needs gentler handling. Excessive grip pressure compresses the tiny blood vessels inside erectile tissue. Over time, that compression can damage the very structures responsible for healthy blood flow. And when blood flow is compromised, sensation drops, erection quality drops, And here's the irony that most men don't see coming. The harder you grip trying to feel more, the less you actually feel over time. It's a vicious cycle. You squeeze harder because sensation is fading, but the squeezing is exactly what's making sensation fade in the first place. I've had patients tell me they thought they were just getting old, that losing feeling down there was inevitable. But when we looked at their habits, the pattern was clear. Years of aggressive technique had gradually dulled the nerve response, and in some cases, it had caused bruising they didn't even know was there, internal bruising that created inflammation, which then created more numbness, which led to even more force. You see how that spiral works? The solution isn't complicated, but it does require a shift in mindset. Slow down. Seriously, use lighter pressure, focus on rhythm instead of intensity. Let sensation build gradually instead of trying to force it. Think of it like this. You're not trying to get to the finish line as fast as possible. You're trying to let your nervous system actually do its job. And when you give it the space to respond, you might be genuinely surprised at how much better things feel. Your body hasn't lost the ability to feel pleasure. In most cases, it just needs a different approach than the one you've been defaulting to for 40 years. And here's something I want you to try. Next time, use about half the pressure you normally would, just as an experiment. Most men who do this tell me they notice sensations they hadn't felt in years, because when you remove the overpowering grip, the subtle signals finally have room to come through. Now, I want to pause here for a second. Drop a comment below telling me what state you're watching from, because I see men from every corner of the country dealing with these exact same issues, and most of them had no idea these habits were connected to their symptoms. I read every comment, and your questions might end up in a future video. All right, now we get to mistake number 3, and I told you at the beginning to pay close attention to this one, because this is the mistake that flies completely under the radar. Men don't think about it. Doctors rarely mention it, and yet it can trigger infections, skin problems, and urinary complications that seem to come out of nowhere. What is it? It's what happens, or more accurately, what doesn't happen, in the minutes right after ejaculation. Most men finish and that's it. They're done. They move on. Maybe they clean up eventually, maybe they don't. And for a younger man, the body can usually handle that. But after 60, your immune defenses in that area aren't as strong. Your skin barrier is thinner. And if you have an enlarged prostate or blood sugar issues, your susceptibility to bacterial growth is significantly higher. When residual fluids stay on the skin, they create a warm, moist environment. That's textbook conditions for bacterial multiplication. And that bacteria doesn't just sit on the surface. It can migrate, it can reach the urethral opening, and from there, it can travel upward, potentially causing a urinary tract infection. Now, most people associate UTIs with women, but men get them too, especially older men. And when a man over 60 gets a UTI, it can be more serious. It can affect the prostate. It can cause burning, frequency, urgency, and in some cases, it can lead to a more complicated infection that requires aggressive treatment. All of that, from simply not cleaning up properly afterward. It sounds almost too simple to be dangerous, but that's exactly why it catches men off guard. So here's what you need to do. Every single time, without exception, wash the area with warm water shortly after. If you want to use a cleanser, choose something pH balanced and fragrance-free. Stay away from regular soap, especially anything with strong scents or antibacterial chemicals, because those can actually strip the natural protective barrier of your skin and make things worse. And don't forget to dry thoroughly. Moisture left behind just continues to feed that bacterial environment you're trying to eliminate. This is basic hygiene, but I cannot overstate how many problems I've seen in my practice that trace back to this one overlooked step. Men come in with recurring irritation, persistent itching, unexplained redness, or repeated infections. And the fix was this simple all along. Now, here's something I want to connect for you because it ties all 3 mistakes together in a way most men never consider. When you skip lubrication, you create microtears. Those microtears are tiny open doors for bacteria. When you use excessive force, you cause internal bruising and inflammation. Inflammation weakens local immune response, And when you skip cleanup afterward, you're essentially feeding bacteria directly into tissue that's already compromised. Each mistake amplifies the others. It's not three separate problems, it's one compounding risk. And the men who are making all three mistakes simultaneously, they're the ones who end up in my office with the most complicated cases. But here's the good news: every single one of these mistakes is fixable right now, tonight. You don't need medication, you don't need a procedure, you just need awareness and a few simple adjustments. And if you want to go deeper on this, I put together a practical medical guide specifically about the mistakes that damage prostate health after 60. It's available for free in the pinned comment below this video. No fluff, just clear, actionable information you can use immediately. Take a look when you get a chance because it covers things I couldn't fit into this video. Now, let me address something I know some of you are thinking. How often should I actually be doing this? Is there a magic number? A limit? The honest answer is, there's no universal rule. Your body is the best guide you have. Some men feel best with a few times a week, others once a week, some more, some less. The key is consistency without compulsion. It should feel like something your body wants, not something you're forcing out of routine. And here's something interesting that comes up in clinical research. Regular ejaculation has been associated with pelvic floor comfort and healthy fluid turnover in the prostate gland. Think of your prostate like a reservoir. If fluid sits there too long without being flushed, it can contribute to congestion, discomfort, and that heavy, achy feeling some men describe in their lower pelvis. Regular release helps keep things moving. It's like draining a system that functions better when it's not stagnant. But, and this is important, the benefits only hold if you're doing it safely. If your method involves the mistakes we just covered, the negatives can easily outweigh the positives. That's why technique matters so much at this stage of life. It's not enough to just do it. How you do it determines whether it helps you or hurts you. And there's another layer here that I want to mention because I think it's relevant for a lot of men watching this: the emotional side. After 60, many men start to feel disconnected from their own sexuality. Maybe performance has changed, maybe a partner isn't in the picture anymore, maybe there's embarrassment or shame around the whole topic. And that emotional weight can actually affect your physical health. Stress and shame increase cortisol. Cortisol constricts blood vessels. Constricted blood vessels reduce blood flow to exactly the areas we've been talking about. So, approaching this aspect of your health with acceptance, with self-compassion, with the understanding that you deserve comfort and pleasure at any age, that's not just a feel-good idea. It has real physiological impact. Your mindset and your body are not separate systems. They're deeply connected. Let me give you a quick summary of what we covered because I want these to stick. First, always use proper lubrication every time, no exceptions. Your tissue is more vulnerable now than it was 20 or 30 years ago, and friction without adequate glide causes cumulative damage that doesn't reverse easily. Second, reduce your grip pressure and slow down your technique. Sensation improves when you stop overpowering your nerves. Let your body respond naturally instead of forcing a result. Third, clean up immediately afterward. Warm water, gentle cleanser if needed, and thorough drying. It takes 2 minutes and prevents problems that can take weeks to resolve. Now, one last thing, and this is non-negotiable. If you experience persistent pain, any bleeding, unusual discharge, a noticeable change in curvature, significant loss of sensation, or difficulty with erections that doesn't improve, see your doctor. Don't wait. Don't search the internet for answers. Don't assume it'll go away on its own. These are signals. And catching something early is always easier than treating something that's been building for months or years. Your body is talking to you. The question is whether you're willing to listen. And if you made it this far in the video, that tells me you are. That tells me you care about doing this right. And that already puts you ahead of most men your age who won't even have this conversation. If this helped you see something differently today, subscribe to this channel because every week I break down the health topics that matter most for men over 60 in a way that's clear, direct, and actually useful. No sugarcoating, no unnecessary jargon, just the information you need to stay ahead of problems before they start. In the next video, I'm going to tackle something that's closely connected to everything we discussed today: low libido after 60. Why it happens, what's actually driving it, and the natural strategies that can genuinely help bring things back. That video is going to challenge a lot of what you've been told, so make sure you don't miss it. Stay sharp, stay informed, and never stop taking care of yourself.